Good morning. Welcome to the program on Health Talk. I'm Dave Wilson. Our guest this morning is radiation oncologist at Mon Health Cancer Center, Dr. James Littles. Good morning, Dr. Littles.
How are you, David? Long time no talk to.
I know, it's been a while. One of these days, I'd like to actually get you back in the studio.
Yes. How's my friend Sarah doing?
She has been doing pretty well. She's tough as nails, you know, Sarah. So she's hanging in there.
Great. How's her family?
Family's doing well. Boys are, it takes a lot of energy to keep up with them, James. So they're all hanging in there. How have you been? It's been a long time since we've had you on.
I've been great. Things are well here in Morgantown, and it is interesting for me that since the last we talked, I found out the hidden jewel of Morgantown, West Virginia. One of the hidden jewels.
What's that?
Very few mosquitoes.
That's true.
Well, Dave, I grew up in South Carolina, and I spent all those years in Michigan, and a ton of mosquitoes in both states, and because of a very little staggered water. I've seen maybe 3 mosquitoes in a little over 2 years here in Morgantown. That's a big change for me.
You know what? I've never given it that much thought, but I think you're onto something there. Maybe we can put it on a pamphlet one day.
Yeah. Very little standing water in Morgantown, West Virginia equates to very few mosquitoes.
There we go. Well, hey, November, it's hard to believe it's November already, for one, but November is Lung Cancer Awareness Month. So why is it important for lung cancer screenings to be part of some of the standard screenings folks need to look into?
Thank you so much, David, and it's real simple for me. David, I'm a numbers person because numbers never lie. 132,000 deaths predicted from lung cancer in 2021 compared to 52,000 colorectal, 44,000 breast, and 34,000 prostate. So when you compare 132 with 52, 34, and 44, there is no other thing to discuss when you're trying to demonstrate the importance of lung cancer screening. I mean, 132,000 deaths versus 44 with breast and 34 with prostate and 52 with colorectal.
How prominent is lung cancer here in West Virginia?
Well, unfortunately, Dave, there's some bad news there as well. 25% of young adults and adults in West Virginia are cigarette smokers. That leads the nation, Dave. Unfortunately, we here in West Virginia lead the nation in cigarette smoking. And 80 to 90% of all of these deadly lung cancers are cigarette related. So from a plethora of reasons, this is a very, 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 very important radio show here this morning.
It seems like that would highlight the need to make sure you're keeping up on the screenings, just given those numbers with the other numbers you talked about. That just highlights the importance of the screening. There
is no doubt about it. And like I said, Dave, I'm a numbers person. Numbers never lie. When you lead the nation at a 25% smoking rate, 80 to 90% of all lung cancer are cigarette related, 132,000 deaths compared to 52,000. The number 2 location is colorectal, and that's just 52. I mean, numbers never lie, Dave. This is a very, very important Mon Health Talk radio show. Very important for the state, and very important for the nation.
You know, you mentioned the smoking numbers, and certainly that seems like it would be the number 1 risk factor of lung cancer. What are some others?
Well, the second one, and it's a distant second, Dave, is radon.
Really?
But yeah,
how so?
Radon is rampant in West Virginia, but radon is rampant in Michigan. And when I say second, I'm talking about a distant second.
So by far, when we talk lung cancer, it's smoking related. Was that fair to say?
Yeah, Dave, and I remember being at a morning grand rounds when I was on the faculty at the University of Michigan, and one of the researchers said, all the research you can do as one of the finest cancer facilities in this nation. All the research you can do, you can save more lives by encouraging your patients to stop smoking than all the research you'll ever be able to do as one of the finest cancer institutions in the nation.
It seems so simple.
It seems so. See, a lot of things are simple, Dave, that are not easy.
Right.
There are a lot of things that are extremely simple in life that are not easy, because when you think about that, nothing great in life is ever easy.
That's a good point. That is an excellent point. It's a very simple concept, but in practice, it's not as easy as it sounds.
And the reason why it's not easy is because nicotine is a hardcore cocaine-like addictive substance, 4 times deadlier than liquor. But nicotine, I learned in medical school, is a hardcore addictive substance. So yes, it's a simple concept to stop smoking, but it is not easy to stop smoking.
Our guest this morning is Dr. James Littles, radiation oncologist, Mon Health Cancer Center. November is Lung Cancer Awareness Month. With the risk factors we've talked about, also with lung cancer, it's asymptomatic, isn't it? You may not know you have it for a very long time. Is that true?
Unfortunately, that is very true. The nodules start very small. Some of the smokers have a chronic cough and a little shortness of breath, but that's what they've dealt with for 10, 20 years. And all of a sudden they have a lesion that continues to grow, and they don't notice any major symptoms until a lot of times it's in a late stage and a lot less curable. That's what makes lung cancer screening very important. And we should be excited that the data is very clear that lung cancer screening saves lives. So, and we can get into the numbers later, but if you do a statistical dent in that 132,000, you would pretty much equilibrate all of the deaths in prostate cancer.
Wow.
So if we aggressively screen for lung cancer, it's analogous to eliminating prostate cancer in the number of deaths in this country. When you think about that concept, that makes it tremendous. That makes what we're talking about this morning very, very important, David.
So how do you – we've talked about getting the screenings important. So how do you actually screen for lung cancer?
You screen for lung cancer with 2 major studies, one out of the United States with 53,000 participants that showed a 20% lower mortality rate, another one out of the Netherlands with, I think, 15,000 patients with a 25% mortality rate reduction. And you screen and these are again 53,000 participants in one study and 15,000 participants in another, showed a significant reduction with low-dose screening in a subset of patients. And that subset is age 55 through 57, current smokers or quit within the last 15 years. Most of them, and all of them, are somewhat required to be asymptomatic and have a tobacco history of 30-pack years. And 30-pack years is a pack and a half a day for 20 years, or a pack a day for 30 years, or 2 packs a day for 15 years. It equilibrates to a 30-pack year history of cigarette smoking.
Wow. That just seems like a lot. But these low-dose CT scans, what are you looking for in these scans?
You're looking for hopefully nothing, but in a small subset of the people screened, you'll see a small lung nodule. And then you work that lung nodule up from there, and some of them will be early cancers. And when you pick them up early, there's a 60 to 70% chance of a long-term cure versus picking up late, and that number goes down to 15%.
Wow.
So 60% when you pick it up early, 15% when you don't.
Well, like any other cancer, if you catch these in the early stages, it increases your chances of beating it, surviving it. But from the numbers you've talked about here today, Dr. Little, it would scare me away from going to buy a pack of smokes. Not that I would anyway, but it would scare me away from doing it. Just hearing the numbers you're talking about here this morning, it seems all very avoidable.
Yes, I think it is, and once again, the curveball is current smokers. Mm-hmm. Current smokers are addicted to a hardcore addictive substance, which is nicotine.
Yeah.
So attacking those current smokers and giving them assistance to quit, and then screening them if they're at risk, that is where we start. And we also start with educating junior high school kids never to start.
Our guest this morning, Dr. James Littles. He is a radiation oncologist, Mon Health Cancer Center. Got to squeeze in a quick break. We'll continue the conversation in a moment. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guest this morning is Dr. James Littles, radiation oncologist, Mon Health Cancer Center. We're talking about Lung Cancer Awareness Month. November is, hard to believe it's November, but November is Lung Cancer Awareness Month. And Dr. Littles, we've talked about this on several of the episodes over the last, going on 2 years now, but why is it so important to continue to get screenings even during this COVID pandemic?
Yes, thank you so much, David. I think, first thing, first is being vaccinated is a public health issue. Mm-hmm. I think our community at times looks at it as a personal issue, but we've had mass recommendations and vaccines recommendations, for quite some time now, and we should all really look at that as a public health issue. So, with all of us being vaccinated and wearing masks and protecting one another as a family, as a large community, I believe this pandemic will be over soon. So I want to say that first and foremost. But lung cancer screening, because of the deadly nature of lung cancer, it's still important to participate in that with all the necessary COVID restrictions. We still screen of all our patients, and a lot of times prior to procedures, we have them to take a negative test and go from there. But ideally, more and more, a higher and higher percentage of the patients that come to the hospital for other procedures are vaccinated. So there's room in the ER for someone else who really needs to be there. There's room in the unit for someone else that really needs to be there. And there's room in the intensive care. I mean, in the vent space for other people need to be there. So we should look at vaccination masks as public service, as a public health issue, and how we can protect one another as a community and a family.
Talking to Dr. James Littles this morning, and and this is me connecting dots here, so stop me if I'm wrong. We've only got a couple minutes left. With COVID being a respiratory virus, smoking, what we talked about, lung cancer, those are not in good combination, if you will. If you can help me out, follow me where I'm headed here. Mm-hmm. With the COVID pandemic, all of that is going to compound and make everything harder on the patient. Am I in the ballpark?
Yeah.
Okay.
You're absolutely right.
Okay.
And what's been a tremendous strain on our healthcare system is people going to the emergency room, unvaccinated, mm-hmm. going and requiring to be on the vent, unvaccinated, requiring to be in the unit, unvaccinated. That's put a tremendous strain on our healthcare system and distracted a number of our providers from other people who need critical care.
And we've got just a couple of minutes left here. So for someone who is interested in getting a lung cancer screening, or they feel like they may be having an issue, how do they get more information? How do they set up a screening?
Very good. They certainly can visit monhealth.com/lung cancer to request more information. monhealth.com/lung cancer.
And would they get referred for a screening from their primary care physician? Could you just schedule one? How does that process work?
They actually can talk to their primary care doctor, or if they qualify, can actually schedule one outside of their primary care doctor.
And just remind us, who should be getting lung cancer screening? Should it be a part of your regular screenings, or is there a particular group who absolutely should be getting them?
Yes, the eligibility criteria is age 55 to 77, current smokers or those who have quit within the last 15 years, asymptomatic, relatively asymptomatic, and have a tobacco history of at least 30 pack years, which is 2 packs a day for 15 years, 1 pack a day for 30 years, or a pack and a half for 20 years.
And, of course, people can reach you at monhealth.com/lungcancer or monhealth.com/cancer for more information. And what's the message you want to leave people with today, Dr. Littles?
Twofold. If you're a cigarette smoker, one of the greatest things you can do for yourself and your family is to quit smoking and to look up the term third-hand smoke exposure. Not first-hand, not second-hand, but something called third-hand smoke exposure, which, believe it or not, third-hand smoke exposure is very dangerous. And if you're a smoker and you fit the screening criteria, please get screened right away. It certainly can save your life. There's a great chance that we can detect it early. And if it's detected early, it's very, very curable, as opposed to letting things progress to 2 to 5 years from now when your cure rate is significantly lower.
Dr. James Littles, our guest this morning with Mon Health Cancer Center. Dr. Littles, always appreciate the conversation. Stop by as soon as you can.
Yes, you too, David, and please tell Sarah I said hi.
Will do.